I'm Helen Cullington. I'm an audiologist at the University of Southampton. Lots of people with cochlear implants told us that they wanted to take more control of their own hearing healthcare. So we developed some remote care tools that patients could use at home to care for their cochlear implant. We did a project where 60 people were involved. 30 followed their usual care pathway, and 30 people used the remote care tools at home. The tools they used were a home hearing test, some people did some mapping at home, and a personalised online support tool for rehabilitation, troubleshooting, advice and other help. People using the remote care tools at home felt more empowered, they enjoyed using them, and they wanted to carry on. We're going to hear now from some people who use the remote care tools to find out how they got on.
The hearing test has been the best, and I found that at different circumstances, for example, first thing in the morning, before the hearing aid and the implant goes on, I would put the implant on and then straight away have the hearing test, because I feel that when you wake up in the morning, you're at your best.
I think it's useful to be able to know when to change your microphone covers, when to check the coils. But of course, with this latest tool that we can do on the computer, that gives you a very good idea.
I've enjoyed the tests and the hearing tests. I also found helpful the additional thing, for instance, using the phone and getting a feedback on the phone, or testing yourself against the phone.
Well, sometimes you feel, maybe if you're not very well or something, you feel that your hearing's going down. So it's useful to be able to test myself where at the end of the day, or if I'm stressed out, I'm not getting the same quality of hearing as if I'm normally relaxed.
Sometimes you succeed better, like the hearing test. At home I was doing sort of like 1.5 or whatever, minus 1.5.
Yeah.
Here it's more like minus 0.75.
Oh, yeah.
So it's about half as good. Realistically, you actually achieve better in your own front room. I'm happy to come when I need to come.
Yeah.
Because you can reassure me. If we had a situation where there was a sort of a Skype situation, or it doesn't have to be Skype, it can be messaging, and there was somebody at the other end who would say, "Oh, don't panic," and you then would assess whether this was a situation that needed help or not.
Being aware whether the process is working okay, and getting in touch with the department if you feel there's really some problem.
I've sometimes done the 160-mile round trip, and we've moved one electrode, one tiny little bit, and that's all that's happened. Now that could have been monitored, and I could have done that from home, and could have seen that things were okay.
Well, I've enjoyed the project, and I think it's given me a feeling of being able to help myself. I'm very firmly in favour of as much control as possible, as long as we've got the backup from here.
Yeah.
Then I think we should be in control as much as possible of our own hearing destiny.